Hi everyone, welcome to the next episode of What Everyone Should Know About Health. Today we're going to cover some topics that you may not be particularly familiar with, but you probably heard them in the press, on social media. So welcome back again, Elizabeth. Nice to see you again today.
Hello, good to be here.
I'm going to list a few things, Elizabeth, and I'll let you sort of choose them in any particular order, being our medical expert. But cytokine storms, hydroxychloroquine, and zinc is a sort of I don't want to use the word cure, but we've also heard about a tonic, a natural tonic that's being produced in certain African countries, etc. Vaccination, we said we'd cover that in some detail. Death certificates, herd immunity, social distancing, the effects of lockdown, what it's having on people. So yeah, let's start sort of initially from the top of my list there. Cytokine storms. What are they? I mean, I know what they are, and I know that initially when the first serious bout or numbers came in with people suffering from COVID-19, a lot of the intense care units were administrating people. Let's say they're in incubation, and they were obviously having oxygen. I don't like to use the term, but forced into potentially damaged lungs. So yeah, that brings us on to the subject of cytokine storms and how maybe you should or should not treat people depending on what their actual condition is. So over to you, Elizabeth.
All right. Thank you. So this is a big topic, and maybe I should just take a moment and explain what a cytokine is. So cytokines are signaling molecules that the body uses to communicate as part of the inflammatory response. So if you get a splinter embedded in your foot, if you have a cut, if you have a bacterial infection, a viral infection, a whole variety of things can bring up cytokines. And that's just the way the different parts of your immune system talk to each other. That's all it is. What happens, and I should tell you that the cytokine cascade, that's what it's called, the cytokine cascade, is incredibly complicated with dozens of different signal molecules or cytokines that are involved. And I personally believe it is so complicated that no one really understands it. We think we understand it, but people don't fully understand it. So what happens with cytokine storm is when the body produces all of these cytokines, or many of the cytokines, in great number, in great amounts all at once. And that has the effect of both causing more immune inflammatory cells to be involved, and it changes, it causes the cells in an area to change. So this cytokine storm that people are experiencing as part of the COVID-19 syndrome particularly affects the lining of blood vessels, teeny tiny little blood vessels and big blood vessels alike, causing those blood vessels to, the lining to not function well. And that is the basis of why people are experiencing poor oxygen. It's that their blood vessel walls are not functioning properly to allow oxygen to enter the body from the lungs. So it's been discovered that forcing more oxygen in, making people have more oxygen or blowing it in under pressure, doesn't help if your blood vessel walls are damaged enough that it won't allow the oxygen to get into the blood. And these blood vessel problems are also part of what people are seeing with rashes and other organ systems, because we have these blood vessels everywhere, you know, thousands of miles of blood vessels through our body. And all of those little tiny lining cells are being damaged, causing lack of blood flow throughout the body. So that's what a cytokine storm is and what it does in the body in this particular case. Cytokine storm does not necessarily mean a person has an overwhelming amount of infection. A person doesn't have to have a serious amount of, have been exposed more than someone else. And I just want to raise a little topic that we might bring up in a future video, Glenn. I just give this to you. One interesting fact is that being in fear raises your cytokine levels to start with. So that when this is done in experimental animals, they don't do it in humans, but in experimental animals, inflammation levels and cytokine levels do rise when the animals are artificially exposed to stress or fear or restraint. There are a number of ways to do that. And my question is this level of fear priming people to have cytokine storm? And it's a question I don't think we're going to answer, but it's a question that needs to be asked. So back over to you.
That's great. And again, I know that we keep deferring things to later videos, but we've agreed that in the shorter videos, we're really just trying to let people know that, our expanse of information that we want to pass over to people is great. This is only the beginning of this series, and we're going to go into things in greater details. The conversation we've just had there, obviously, about increasing cytokines. Obviously, I think most people understand that stress causes the raising of cortisol levels as well, which we can discuss in greater detail. I'm only touching on this subject because even though we're talking a little bit historically about what has happened, is that, you and I have been having these conversations now for months, if not years. We're not suggesting for 1 minute that we predicted there could be a global pandemic, but we were to a certain extent prepared to say that in the event that anyone should have any concern about any virus, that all these subjects that we're talking about now are highly relevant. The way you live your life, your lifestyle, the strength of your immune system, how and what vaccinations you've had so far to date, your stress levels. And I think one of the major concerns that I've certainly heard is that let's go back to call it the early days of COVID-19 a couple of months ago. There was a number of concerns, and not that it's for us to judge, and we're not going to judge, but there was the comments that some of the early symptoms were a little bit like altitude sickness. And I think that there was a level of concern, certainly from certain nurses, that maybe certain hospitals were not reacting in the way by producing their normal standard procedures like CPAP. So I just have a little bit of a concern that maybe some people were being administered, pressured oxygen when it possibly wasn't the right treatment. Would you concur?
Yes, I would. Now, I don't work in ICU, so I don't have personal experience with this, but I do know that people who are on mechanical ventilation do experience problems later on. There can be lung injury from the pressure. Higher amounts of oxygen that you'd think that, we should breathe 100% oxygen. Actually, we shouldn't. That produces free radicals that then can cause damage. We're supposed to breathe air at about 20% oxygen. And when you go significantly above that, you actually damage the lungs. And then when you are breathing through a tube or a machine, and there are things that can get into that breathing apparatus that can be other bacteria, funguses, and things like that you can breathe in, and it's forced in. And of course, if you are under mechanical ventilation or you're paralyzed, in order to make mechanical ventilation easier, you can't cough it out. So it's the idea of being put on a ventilator as being this life-saving cure. No, they often produce as many problems as they do success stories. And that's certainly been the case in this situation.
You mentioned a word there, free radicals. I think it's probably fair to say to our viewers now, from an honesty and a candid point of view, is that we've been working over recent months looking to set up what everyone should know about health. Obviously, this our development of that has been pushed back now, because it's almost what everyone should know about COVID. The problem is that the two basically interact. We will be talking in future videos about free radicals, how free radicals are created by the environment that we live in, etc., etc., etc. But if we can conclude today, there is something that I'd like our viewers to take a look at. We're talking about a lot of facts here from a medical point of view, but we would like to ask our viewers to take a look at the government facts and figures. There is a friend of mine I mentioned in previous videos, Andrew Mather from Peerless Reads. Andrew is a mathematician and a genius of a man, and he's worked tirelessly so to produce basically the facts of government figures, which is also a concern for all of us. So if anyone would like to take a look at Peerless Reads on YouTube, that's P-E-E-R-L-E-S-S, new word, Reads, R-E-A-D-S. Andrew has put together all the figures so far from around the world showing the numbers that relate to this infection. So I'd really urge people to take a look at that. In the next video, we're going to talk about herd immunity, social distancing, etc. So thanks again for today, Elizabeth, and look forward to seeing you there.
Absolutely.
Thanks again. Thanks. Bye-bye.
Bye-bye.